Hello and welcome to Healthy Living. I'm Dr. Donald Pelto, and this week we're going to look at a few other things that we've been seeing in the office this week. Let's go here and take a look. So we'll talk a little bit about a flat foot question, the difference between a wart and something called a porokeratoma, which are very similar, how to deal with a crack in the nail, kind of a bad healed fracture, my first attempt at Onifix, and also Cariflex for the nails. So let's go into this. The first question that I had, and once again, if you want to ask a question, just put a question at the bottom of this video or at one of the other videos, or you can kind of do a high-tech way. You can go and sign up to be part of this Ask Dr. Pelto. So recently I started walking. My daily average is 6.5K. I also do 40 to 60 minutes of yoga in the morning, downward dog. I started experiencing mild inflammation in the area of the tendon shown in the picture. I'll show you the tendon. She was watching the video of the posterior tibial tendon. Especially when I lie down, it feels like it's collapsing inward and I need to adjust to feel comfortable. What do you recommend at this stage for mild inflammation? So let's review what we were talking about. I was talking a little bit about this posterior tibial tendon dysfunction, and what the kind of collapsing in is when the foot collapses in versus being stable. I do have a little checklist here of things that you can do, and this is under the video on this condition, flat foot or posterior tibial tendinitis. When it's very mild, certainly a little bit of icing can help, sometimes anti-inflammatories. I find that giving the foot stability and support really helps the best. So a supportive shoe, maybe a flip-flop or something. There's one that's called an UFO that's very, very good. It helps give more support. You may like that. And then the problem is you're doing these things barefoot, and if your foot's collapsing in, it could be inflamed a little bit. So maybe some foam rolling or deep tissue massage to the back of the calf region can be quite helpful for something like this. Okay, if that doesn't work, you probably should see a doctor depending on the pain level. But if it's just due to function, try to alter your function. Next question that's in Portuguese. It says it's about wart removal video. I did this surgery and it came back again. I was a couple of days. I couldn't even walk. It hurt a lot. I want to talk a little bit about wart removal because not every wart is a wart. So here's some examples of warts. They tend to have pinpoint bleeding in them. And let me show you something that's very similar. Okay. These things are very similar to warts, and they're commonly misdiagnosed as warts. Looks very similar, has a little circle, and a lot of times these can be removed and they're not a wart. The definitive way is to remove it and send it to a pathologist and they'll tell you, but these are called porokeratomas, or just calluses that are focal. The poro comes from like the sweat gland, so it's a clogged sweat gland in that area, and if you remove these, they will come back because they tend to be on areas of high pressure or areas where there is a clogged sweat gland. There are some treatments for them that sometimes work. There's nothing really, really great that I know. If you know something great for these, please put it in the comments section. But what I tend to try is I trim it. I have them use a pumice stone, maybe some type of a pad, heat molded cushion insert or an orthotic, something to soften the skin. And then surgery sometimes can be done, but a lot of times it's just that treatment with some type of salicylic acid type of a cream to take out, like a wart cream. You could even use that in there. Okay, be careful once again if you're diabetic, things like that. What about cracking of the toenail? So here's an example of someone that gets cracking of the toenail. We have to figure out why. Was it just because it cracked, because the nails are lifted, because there's a fungus, because there's a nutritional problem? So something you could start with was like biotin. You can do biotin, that sometimes can help. You can trim it back if it was easier and it was detached. You could trim this one. You couldn't trim back. You could remove the toenail, I guess. You could put that Onifix brace on there, so as it grows out, it's not going to crack anymore. But the easiest thing for a lot of us is just to put a little super glue on there. Put the super glue, that'll help it to stabilize as it grows out. Once again, check with your doctor, but that's just a quick little solution. Here's my first Onifix, okay? You can critique it with me. So here's what it's supposed to look like. Here's mine. It's not as pretty, a little bit wide. I didn't taper the ends like I was supposed to, but this patient, she had an ingrown toenail. So she was older, like 70s or 80s, chronic ingrown painful toenail. When I talk about patients, I go over this slide basically with them, and you can find this in my slide section. And I'll put a link to it here if you want to look at some of my slides. But the options I give people for chronic ingrown toenails, we can remove a portion of it, we can kill the root with a matrixectomy, or if you're older, you can do something called onifix, and that's where we put this little band on the base, and then over a number of treatments, it's going to grow out more normal. Okay, that's what we do for that. Also, a patient that had this kind of soft tissue thing in the front of the ankle, and we've removed it, so that's something else that you may be interested in. I think I'll put the video up a little bit later. There'll be a video on this. That's something else that we've done this week. And this is kind of a bad picture. I apologize. The picture on the left is horrible, but you can kind of see they're kind of horrible nails. They're kind of eaten in here. We were unsure if it was a fungus or if it was just detached or if it was due to tight shoes. But what this patient had was a nail avulsion with a Kera nail gel. So in this patient, I took it off, and we're looking at 9 months later. They look so much better here. And they use something, it's a urea-based gel. So it's not, you don't have to do Kera nail gel, but it's just one that I do because when you pull off a nail, it gets nail bed thickening, and then it'll grow back, hopefully a little bit normal. Not everyone does that, but that's something that helps. Here's a patient. She was just so happy. This is a little younger woman. Her nails, she had these ingrown toenails done in the past, and you can see how narrow it is and how it just doesn't look full. It doesn't look nice, and it doesn't go out past here. So this is that KeriFlex. This is what's great. I'll put a couple of links if you want to learn more about KeriFlex underneath here. But it's like a fake nail you apply on there. It looks really good, lasts about 2 months for the summer, and they can paint these and it looks totally normal afterwards. So, and then finally, a patient, just I think it's fun for people. I like to show these to patients, and you can see what a fracture happens if you don't stay off of it. And this patient probably had a fracture right around this area, and it gets all this callus formation, just gets thickened, got a little bit shortened. This patient's fine with this, but this is what happens to a fracture if it's not treated. So once again, I hope you enjoy this. If you want to learn more, you can certainly subscribe or look at some of these other videos that'll be attached here. You can go to drpelto.com if you want to ask your own question and participate in my weekly program here, but not many people, they usually put a question in there with a fake email and then they don't even participate. So if you have a question, if it's easier, just put the question underneath it. If you want to actually participate, just put your name and email and use this link here, and I'd be happy to answer it with you on the program. Okay, hope it was helpful. Thank you.